So the thing about the head that you have to learn is that the head is really a crane, and that all the muscles of the neck that you would think are strapped from your throat to the bones of your neck. It doesn't do that. Instead, they're suspended between your head and your chest so that they hold up your trachea and your esophagus between them. Because what you need is you need to be able to eat popcorn way over here, and then be able to swing your head way over here and drink some fluid, and be able to talk all the way in between. So your throat actually has to stay with your head. When you turn your head, it's got to slide around to one side, and when you turn your head the other way, it's got to be able to slide over there and remain functional. If it attached to every single one of your vertebrae, that wouldn't happen. So here's the way it's actually set up. And this is just a way to memorize what they do. So this is the mastoid process, styloid process, the maxilla, the mandible, cricoid, hyoid bone, thyroid cartilage, cricoid cartilage, then the sternum, and the shoulder blade. Remember that place in the shoulder blade where the nerve went underneath and the artery went over? That spot on the shoulder blade. And so the muscles all arise from these structures in order to hold on to the hyoid bone. The hyoid bone is the center of the universe here. And it's held up by a muscle called the digastricus. The digastricus goes from the mastoid process, goes all the way down to the hyoid, and then bounces up to the inside of the jaw, right around the genoid process. So it holds on to it on either side and holds the structure up, because I'm not talking about any of the muscles that turn your head, open your mouth, close your mouth. I'm only talking about the muscles of the throat, and there seems like there's a bunch of them. So this one, digastricus, holds everything up. Then you have another one coming down from the styloid process, holding that up. That's stylohyoid. Then from the sternum, sternohyoid, right? Now, it also needs to stay with the thyroid cartilage because they move as one piece. So sternothyroid and thyrohyoid, right? So that they move together. Then you want the cricoid to stay with them, so you have the little cricothyroid muscle attached to them. You then have another muscle that goes along the whole wedge side of the inside of the jaw, which is called the myloid line, and goes down and attaches to the hyoid bone. So that's the mylohyoid. And that's just all the muscles that help you swallow and move this apparatus. They don't necessarily make you talk, but they do hold everything up for you and make sure that it stays with your head when you turn it. The next thing is the tongue. So the tongue sits in here and needs to be able to move in all of those same cardinal directions. So to pull your tongue out, it goes to the genoid process on the inside of the jaw. Okay? That's genioglossus. Okay? It attaches from here, of course, to the hyoid bone, like every good thing does, and that's hyoglossus. Okay? It attaches here to pull that thing back into your throat. Pull your tongue back, that's styloglossus. Okay? Then from up here, from the hard palate, coming down on either side, is palatoglossus, to be able to shove your tongue up against the roof of your mouth. Does that make sense so far? Yeah. Then, everything that doesn't go down your windpipe is supposed to go down the garbage chute of your esophagus. Okay? Now that esophagus, everything has to tumble into that. Now there's a protector for your windpipe so it doesn't go in there. So it's all just supposed to tumble down and go down your throat. It is attached to this at the top to the top of the pharynx, by a muscle called palatopharyngeus. Okay? And also has an upper, middle, and lower esophageal constrictor, so that it moves where the trachea moves. Does that make sense? Then, one more muscle, stylopharyngeus. Now, this now makes no sense, right? It's just some gobbledygook. But what I want you to see is that there's three parts to it. There are the muscles that move the hyoid, the muscles that move the tongue, and the muscles that move the esophagus. They're so integrated with each other that it just seems like a bunch of muscles. but it really is 3 separate parts. And they're so ingrained with each other that people do an in-block dissection for pathologists. They can actually go up here and cut along the end of the myeloid line and around the genioid, and the heart, lungs, trachea, esophagus, and tongue all come out in one piece. It's called an in-block dissection, but it shows you how these things are all so integrated. This trachea is being held up by the muscles of your neck, so that if I were to slice your throat, your lungs would fall down into your chest cavity, right? This whole structure is holding up your lungs, your trachea, all those things. And that's an easy way to think about the muscles of the neck.